Department of Health and Family Welfare. Government of Kerala, Standard Operating Procedure for Healthcare in COVID-19 First Line Treatment Centers. June 2020. Part 2. Arrangements at entry to CFLTC. A multilingual display board should be placed in front of the entry gate as COVID First Line Treatment Center, Pradhamika COVID Chikitsa Kendram. Board should also specify that entry is restricted to COVID patients and staff on duty only. 24/7 security service of watchman or gatekeeper should be provided. As part of infection control, entry of vehicles should be restricted, except for patients, staff, logistics delivery and transportation of waste. Single bystander, preferably constant, will be permitted only for children and those who need support like old age people and physically challenged. Adequate number of signages showing the direction of entry to the CFLTC should be installed. Sanitizing area with wash basins, soap and uninterrupted water supply. Poster on hand washing methods to be displayed. Provision of face masks for patients and bystanders, as per guidelines. Poster or standee for IEC on corona prevention, control and on do's and don'ts. Patient waiting area. Spacious waiting area with adequate lighting and ventilation and 5 to 10 easily cleanable chairs arranged at a minimum distance of 2 meters apart. Drinking water supply should be provided. Poster or standee for IEC on corona prevention, control and on do's and don'ts should be placed. Triaging and registration. Triage area should be an open space with adequate lighting and ventilation. An office table and a chair for the nurse and 2 chairs on the opposite side for the patient and the bystander and a stool for the clinical examination of the patient. Reception, registration and triaging should be done at one point by staff nurse on duty. The triage template should be used for the purpose. The triage or screening area should have clear directions to triage area, algorithm for triage, screening questionnaire as per triage template, documentation papers, personnel protective equipment, hand hygiene equipment, IEC materials and posters, infrared thermometer, BP apparatus, pulse oximeter, stethoscope, waste bins and access to cleaning or disinfection. Signage in local language for patients with specific symptoms to alert healthcare workers. At least one wheelchair and stretcher trolley each. Following steps should be done by the triage nurse. Name, age and address of the patient with mobile number with name and mobile number of contact person also. Presenting complaints, history of presenting complaint, history of travel or contact with COVID positive case or primary contacts. Comorbid conditions like diabetes, hypertension, COPD, cancer, renal disease, mental illness, any other chronic illnesses with treatment details. Preliminary clinical examination. Pulse, BP, respiratory rate, temperature, weight, SpO2, random blood sugar with glucometer in patients with comorbidities. Based on the medical history and clinical parameters, triaging should be done into 3 categories. Asymptomatic suspects. Symptomatic mild, category A. Symptomatic, category B. With severe symptoms, category C. Category C should be examined by the doctor immediately to be referred to COVID hospital. Checklist for screening at admission and referral. The checklist prescribed should be applied as a screening method at the time of admission as well as during the course of the stay of the patient in the hospital. Temperature, respiratory rate, heart rate, blood pressure, comorbidities, SpO2 on room air and presence of any red flag signs are included in the checklist. If any of the above parameters are met, the patient should be referred to the COVID hospital attached in consultation with the hub team. In order to provide timely referral to higher centers, basic life support ambulance services would be made available or linked with at these centers. Consultation room. Consultation room with a minimum of 5 by 3 meter size, or in case of bigger rooms or halls, consultation areas may be arranged with adequate privacy, proper lighting and ventilation. Examination table with foot stand, consultation table with 2 chairs and a stool in addition to 1 chair for doctor. Washing area with uninterrupted supply of water. Consultation rooms should not be air conditioned. At a time, only 1 patient would be permitted inside the consultation room. Overcrowding should be avoided in front of the consultation room. Thank you for patient listening.